Can you briefly give us a definition of Cushing syndrome and Cushing disease?
So, Cushing syndrome is basically a basket of diseases that are all characterized by elevated cortisol in the body. There are several etiologies or reasons for elevated cortisol in the body. One of them is if you have autonomous secretion of cortisol from the adrenal glands. Another one would be elevated cortisol secondary to some kind of malignancy of cancer. And the most common one, about 70%, would be secondary to elevated ACTH secretion from the pituitary, elevated adrenocorticotropic hormone from the pituitary that triggers hypersecretion of cortisol from the adrenal gland. The symptoms of a Cushing syndrome or Cushing disease, some of them are very nonspecific and can be seen in other patient or under population, in the general population, like hypertension, obesity, osteoporosis, depression. However, there are some more specific symptoms or signs to Cushing disease or Cushing syndrome, like rounding on the face, accumulation of fat above the clavicle or behind the neck, easy bruising, purplish stretch mark, weakness of the muscles, specifically in the shoulder girdle or the hip girdle, and increased risk for infections or increased blood clots, and so on.
Can you please describe your journey with Cushing syndrome and how it has an effect on your life?
Well, in the beginning, when I first didn't even notice that I had Cushing's, it was interesting to me because I was gaining weight. I had, like Dr. Tal was mentioning, roundness in my neck and the face. My hormones were a little out of line, and my behavior problems were just really elevated. And several months I would exercise, diet, eat right. The weight would go down of maybe, I would say, 2 pounds. And then all of a sudden, the next week, it would go up again. And I couldn't categorize or figure out exactly what was wrong with me. And then in 2019, I, took action and I said, there's something wrong, but I can't figure out what that is. And I told myself I need to go see an endocrinologist, and I was referred to one. I saw her, we did multiple testing, we did blood work, urine collection, I did saliva test, everything possible. And we went back and forth for a good, I would say, 6 to 8 months. And this doctor said, I think I know what you have, and can't diagnose you because I want to be sure of it. And it was quite a journey because I had to switch doctors. And I went to a different doctor, and then I've developed lots of migraines. And then I said, this is not normal. So I saw a neurologist, and the neurologist suggested that I do an MRI. And then I said, okay, and I was very nervous. I didn't know what was going to happen. My thoughts were just all over the place. And I couldn't sleep for 1 week because the news came back, and she said, well, not to scare you, but you have Cushing's, and that is a tumor in the pituitary. I had no idea what that was. And it really scared me. And I thought, was my life going to be limited? Was it cancerous? Was it life-threatening? Back then, my daughter, which I have a daughter, and she was in 2nd grade. And I had no idea what I was getting myself into. And it was very scary. And then I was introduced to a really wonderful, great neurosurgeon. A week later, he said, we got to get this done. And it was right before COVID. I said, I was so blessed. And COVID was just hitting right then. And I said, oh my gosh, this is a blessing and a miracle. And I said, I hope something can happen where this will be a life-changing situation for me, because I don't know, all these years I was suffering. It was such a stretch, that what I was going through. Then when we figured out in 2019 what was wrong with me, and I said, okay, let's do this. I was very ready. I was ready to take the change. I was ready to move forward. And hopefully this will make a big difference in my life and then I can become normal again, because there were so many actions and reactions coming in and out, and that was triggering me, and I really needed to fix myself. And I didn't like the way I looked. I couldn't go out. I didn't want to be in pictures. I didn't want to better myself because there was such a barrier, a weight on my shoulders. Going through the surgery was actually very interesting the first time. I had multiple MRIs. I had multiple testings. Um, then the first time, after the surgery, they took me back and they said, we need to do another MRI. There's so many MRIs. I said, I felt like I was so done. I said, I can't do this anymore because it was such a claustrophobic feeling for me. And I couldn't wait till it was over. And then they went back a second time and said, we're so sorry. And then I said, what happened? Oh, we found more, but because we can't really go through and put more time into looking around, so we have to go back and do this a second time. And I got so nervous. I said, oh my gosh, I can't do this. The second time was worse than the first time. I didn't have a great anesthesiologist. I woke up, I felt really angry. I was yelling at everybody. I didn't want to see my parents. I didn't want to see anybody that was close to me and family. I was screaming. I was just in so much pain. I felt like my brain was going to explode. And then I had the nurse, she was amazing. I think it was a godsend. And she took care of me very well. And I told her to close the curtains, put a towel over my face. It was just the light and everything was just so much pressure on me. And I said, I can't deal with this. I did so much blood testing during the days. I was in the hospital for about a good 7 days, from my shoulder to my wrist. I am hard to find veins. My veins are deep and they're just very hard to find. I was poked several times and it was such a nightmare. And so many people tried, and they brought a finder, and they tried to find my veins through the lights and they couldn't do it. And I was bruised. I felt like somebody literally beat me up several times a day, and I got bruised so easily. But finally, there was just one person that came along and just found it on the first try. And it was very tough. It was very tough. And, getting up from bed was one thing, having to finally use the restroom and getting to move around, and I had to walk. I didn't want to. I didn't want to get out of bed. And finally, after I would say 3 to 6 months after I was home, I was a little insecure because I told myself I needed that support from the hospital. I don't know, am I going to be okay? Can I do it on my own? And because the nurses, everyone in the hospital was so accommodating. That was their job and they knew what they were doing. And I felt so comfortable just staying there. And I just wanted to stay there forever. And I said, I asked them, I said, can I stay here longer? And they said, no, you need to go home. You need to figure this out on your own. And I was on, Cortef and all these, taking like 3 times a day and all these meds. And I was just really drugged up, but I had a lot of family support and that helped. After I think maybe a good 6 months, which they did promise me, and I was very hopeful after that. They told me, you will see some changes and some differences. You'll notice a lot of new things and good things. And I did. My weight started going down and everyone started asking me, oh, what did you do? I want to do what you're doing. And what's your secret? It just felt nice that like the weight kept coming off. And after a year, it got better and better. I started exercising, eating healthier, watching my weight, making sure that it didn't go up. I had checkups every 6 months. I did have to do the first year at MRI, which was not pleasant, but I did it and I, fought through it. And it was really amazing, and to see the changes and that I didn't give up. And I think that um I guess if there's a will, there's a way.
From a healthcare professional's perspective, what are the most important comorbidities that need to be monitored in patients with Cushing syndrome and why?
So before I answer, I just want to say thank you, Haleh, for sharing this. I think I'm going to talk about the comorbidities, but I think what you pointed out and also was seen from how you tell the story is that this is a very emotional disease. I feel like facing every new condition, every new disease is emotionally challenging. However, in Cushing specifically, because the elevated levels of cortisol, all the emotions are much more exacerbated. And during the disease, when you are getting diagnosed after the surgery, all these fluctuation and extreme fluctuation in cortisol on top of just the stress of daily living and on top of getting a new diagnosis of disease, it's very challenging. So you are a hero for, going through this path and overcoming what you had. So I'm amazed by you. Regarding the comorbidities of Cushing, as a healthcare professional, I want to address two aspects of that. So the first one is to distinguish between life-threatening condition that can be seen in a very elevated level of cortisol, which are also contributors of morbidity and mortality, which are cardiovascular risks and cardiovascular diseases. Hypertensive emergency can be seen in Cushing patient. And also pulmonary embolism and infection. So all of these are crucial, need to be assessed quickly if needed, and they warrant acute treatment. In addition, or versus this acute emergent conditions, you have the more commonplace, as already mentioned some by Haleh and by me. So weight gain, cardiometabolic health, hypertension, cardiovascular diseases, infections that are more mild. So all this condition have to be addressed regularly to prevent cardiovascular morbidity. However, also most of these patients, if not all of them, will go into surgery. So we really need to make a point to address and keep them in check before the surgery. We don't want the blood pressure to be too much elevated, and we want the blood glucose to be within well control. So it's really crucial to make sure that all of these comorbidities are well controlled before the surgery. The other aspect is regarding the timing of the diagnosis. So as Haleh mentioned, most of these symptoms and signs are mimicking the general population condition, especially given the rise in obesity and cardiometabolic diseases. So it's really hard to diagnose patients with Cushing, especially if you don't have a high index of suspicion, because they're going to experience these symptoms much more before the diagnosis. And we need to keep an eye and to think who we should screen for that. And once we have them screened and once we have the diagnosis, as I said, we need to control all of these symptoms. The next period that we need to think of is perioperatively. As I said, everything should be within normal limits, the blood pressure, the blood glucose, the lipids, to ensure that these patients are at the best health they can have before the surgery. Also, every patient that is admitted to the hospital, regardless of the condition, is an increased rate for blood clots and infections. However, patients with Cushing have a higher risk for that, so they need to be treated with anticoagulative agents to prevent blood clots, pulmonary embolism, and also with antibiotic to prevent opportunistic infections. It is important to note that because patients with Cushing also have brittle connective tissue, they're also prone to bleeding. So although we're giving anticoagulative treatment, we need to just, ping in our back of our head that they are also at risk for bleeding. So we need to make sure that this is balanced. After the surgery, then they are, and also before the surgery, they are more prone for electrolyte abnormalities. They can develop hyponatremia and hypokalemia. So we need to make sure all the electrolytes are well controlled. And after the surgery, as every patient that is undergoing pituitary surgery can develop AVP deficiency or diabetes insipidus, and can cause hypernatremia, elevated levels of sodium. We need to make sure the water balance, the urine output, and the sodium are also closely monitored. And then the next period, the third period, is after the surgery. Because even patients that are already had the surgery or are biochemically controlled, they can still have increased risk of cardiovascular morbidity. They can still have increased risk of heart attack and stroke. They can still have pulmonary embolism and DVT. And also bone abnormalities like osteoporosis or avascular necrosis, which is necrosis of the bone, can all be misdiagnosed and or underdiagnosed and should be addressed after the surgery and after achieving biochemical control. And as Haleh mentioned, there's a lot of emotional and like changes in your mood, and this can also be permanent in addition to cognitive decline, in addition to depression, because there are changes, physical changes to brain structure that may not resolve after the surgery and after the healing. So I would definitely recommend every 6 months blood work to see if there's any recurrence, to make sure that the diabetes status, that the blood pressure, that the lipids in your blood are all within normal range, and to undergo a bone density scan to assess the bone integrity, the bone density. If there are specific symptoms of pains in the joint, you may need also MRI or CT to better characterize that. And I think that psychiatric or social worker or any other psychological support is necessary. Maybe not in every case, but if needed, it should be accompanied in a long-term follow-up.
Are there any comorbidities that you feel are often overlooked by healthcare professionals, but that are a priority for patients?
It's hard to say because when I was going through this and I had a lot of testing done, blood work, the doctors that I had to switch through, and it was very difficult because they didn't want to, I don't know how to say it, not that they didn't want to believe me, but I knew there was something that was going on and I had the symptom. There was something there, and everyone knows their own body very well. And they know that there is something that is not right in their health and in everything that's going on internally. I didn't, when I was actually getting to do more blood work with another doctor, he refused for me to do MRIs, and he didn't give me, I think, the benefit of the doubt that this is what I need and this is where I want to accomplish to get to the next step in my life, because it was important. My health was not getting to a point where it was getting better. So then I had to switch another endocrinologist, and it was going through different stages of different kind of doctors. I felt like a mess. I said, am I ever going to get anywhere? Am I going to get to the point where I'm going to become normal again? And it was difficult. So finally having to switch all these routes and going in different directions finally came to a conclusion, and it was very good. I was on a prednisone for a good, let's say, I think for a good 2 years, until I switched to a third endocrinologist. And because everything was so suppressed, that I was on this medication for so long. But then when I switched to something else, it only took 6 to 8 months, and then I was off of it. So this December would be, I think, 3 years that I'm off the pills to control my cortisol, where I can handle it myself, that I don't even need to rely on it anymore. And it's a good feeling. And this July would be a good 5 years of anniversary that I'm free of Cushing's. And it was very nice because I think it's very rewarding that I got to where I am today. I feel good about myself. I've lost weight. And I'm trying to maintain and stay where I am. And I'm trying to get back on my life. And, it was kind of hard. And I hope this will set a good example for so many out there that either they know what they're struggling, or if they don't, um, I hope this can be a big light at the end of the tunnel for them. Because there is hope, there is a way, as I said, one point I did want to give up, and I said, went to doctors, and they told me so many things, and they said, if you don't do anything about, the situation, like you're gaining so much weight, and you're on the verge of high blood pressure, you're on the verge of diabetes, so many things. And I said, well, I'm trying. I don't know. What can I do to better myself? I'm exercising, I'm eating right. And, I cut so much things out of my diet, but that wasn't it. So when I found out what was going on, if I felt better, because, you know, I have more power to myself, I feel more confident, but there are still some here and there are struggles where I have some insecurities, and it takes time.
Can I add something about after, the surgery and recovery phase? So specifically in Cushing, recovery can take so long.
Yes.
And it's not just because it's a disease that you're recovering from, but also there are two aspects for that. One, like you said, after the surgery, you're probably going to be adrenal insufficient. Your normal ACTH secreting cells in the pituitary are probably stunted from the hypersecretion of the tumor that you had. And once you take out the tumor, you don't have any secretion of ACTH anymore, and there's nothing telling your adrenal to secrete cortisol. So from this level of steroids, you're basically going to zero. And this is super hard for the body and for the mind and for our emotion to handle. So that
Definitely.
takes time for the cortisol and for the ACTH, the normal secreting ACTH cells in the pituitary, to recover. It takes time. And not just that, even if you're not adrenal insufficient and your levels are within normal limit, we do have a phenomenon that is called steroid withdrawal syndrome. That, okay, by blood test, everything looks perfect. But again, you used to be in this level of cortisol. Now you're half of it. Now you're a third of that. Whatever level you are, you're going to have flu-like symptoms. You're going to feel awful. You're going to feel sick. And in these conditions, you probably need a more gradual tapering and the Cortef hydrocortisone treatment, not just, going to maintenance dose once they took out the tumor or the mass. So those are really, it's a difficult recovery. It's not like, okay, they took out this tumor and you're back to normal. No,
Right.
definitely.
No, it's that I agree.
It takes time. It takes time. And every patient should be aware of that. Like, we need to tell the patient it takes time.
That's another thing I wanted to mention, because it was very difficult, because I was looking for an answer quick, and I wanted everything to happen so fast. I said, okay, this is gone, the tumor's out, I feel wonderful, like, okay, so what's next? So I was always in a hurry, and I said, when is this happening? When am I going to lose weight? When I'm going to look good again? When can I get back into the clothes that I feel happy to be in again and look good about myself? And the doctor said, it's all patience. You have to wait. It's all time, because if you can't rush everything, and you will see the difference immediately. And I did, within 6 to 8 months, and even 2 years. I mean, it was incredible. And that being said, there are times that I do feel a little bit, my blood pressure goes down and I feel a little nauseated. And there are times where I feel like a coffee, but it's too strong, and all of a sudden I feel like I'm gonna crash, because it's too. I can't. I've experienced that. I kind of tested that with myself, and I said, okay, no more coffee for you, so you know what triggers you. And I told myself, okay, that you need to stop drinking coffee, because that's one thing that will make me feel like very weak, and then I would feel, okay, I'm gonna pass out. And I've had those moments, and I kind of know how to handle it now. And there's times where, okay, what am I going to do to make myself better? And I said, okay, drink more water, hydrate myself. Then I look back and I said, okay, I try to eat some salty, something with a lot of sodium, so that way I can bring my blood pressure back up. And then I do have some 5 milligram quart of hydrocortisone on hand as, you know, as an emergency. So, and there was a time where it's funny, I went to an amusement park and I went on a roller coaster with my daughter and her good friend. And I said, oh, I'm fine, that nothing's going to happen to me. And it's been so long. I'm okay. I feel good. I went on the roller coaster. I came off the whole day. I was sick.
So that's an important point, what you made just now, because when we educate patients about adrenal insufficiency, what we mainly say is when you are feeling sick, when you have fever, when you have flu-like illness, you should double the dose of hydrocortisone. Or if you have worsening symptoms like vomiting, diarrhea, you should triple the dose or take an IM injection. But cortisol levels do not go up only when we're sick, also when we're in emotional stress, or even in a roller coaster. Like, I'm thinking about myself. I'm going to go on a roller coaster. My cortisol will go up to the sky. If you have enough to sustain your day-to-day life, it doesn't mean that you have enough for these high stress conditions. So before this condition, and even if you feel bad, if you're emotionally stressed, you should take this 5 milligram of hydrocortisone, because stress is not just from a disease. We have stress in various situations in life, and this is important to note. Thank you for sharing this.
What improvements can be made in regards to the diagnosis and management of this disease?
So as we discussed and we mentioned, many of the symptoms can mimic other general conditions in the general populations, like especially with the increase of obesity, with unhealthy diet, with hypertension, cardiometabolic diseases, and so on. So it is very hard to diagnose Cushing disease, or if you don't have high level of suspicion for that. Specifically for me as an endocrinologist, if I have a patient coming with unexplained weight gain, or very short time weight gain, or unexplained increase in facial hair and bruising, I will check the pituitary adrenal axis quite quickly, just to make sure it's not that, or if it is, to start treating for that, or to start thinking about the appropriate treatment. However, I think that in the general population, or with the primary care providers, it's not always like that. So educating primary care providers for specific and non-specific symptoms for Cushing disease is crucial in order to prompt a quicker diagnosis for this patient, because many times the symptoms just overlap. In regards to treatment, every patient with Cushing disease should be managed in a pituitary center of excellence. So they'll have the approach for the most skilled neurosurgeon for their surgery to remove the mass. However, they also need to be seen by ophthalmologists to see if there is any compromise of the visual arteries. And they also need to continue following with an endocrinologist, because not many times, but sometimes you have recurrence of the Cushing, or even not all of the tumor can be resected out because of proximity to other structures in the brain. So those patients may need to have either further medical treatment or surgery or radiation. So they should be followed for a long time after, even for the rest of their lives. Otherwise, they also need to be seen by a cardiologist to continue assess for their cardiovascular morbidity, and social emotional support is warranted if needed. So really multidisciplinary treatment regarding to the comprehensive management of Cushing disease is definitely a high priority.
What final advice would you give to someone newly diagnosed with Cushing syndrome?
That's a tough one, because advice. Well, I think you have to stay positive, and you have to feel there's faith and hope that there will be something that could help. You have help. You can't. The thing is, when I was diagnosed, I was very scared, and a lot of things go mixed messages through your mind. You don't know what's happening. And I think the fact that if you're in good hands with any doctor that you feel comfortable with. I think, there is a way that you can get through this. At first, I was very uncomfortable because I didn't know what this Cushing was. I've never heard of it. And, getting to become educated in something like this and understanding what it is and where it's coming from is very interesting. So I think that anyone who gets diagnosed should definitely take action, take care of themselves, look and seek for help, um, try to get medical attention. I think it should never be ignored because it's a big deal. I think it's something that someone does not want to take any chances in their life to risk. Health is very important in our life, and I think that health is something that everyone should be value of having, and um, just don't give up. I think that there is something, like I said earlier, there's a light at the end of the tunnel, that there is something that you can always look forward to, you know, get better at yourself. And there's so much care, there's so much so much out there in the medical field that can really benefit to us. And there's all this research and all this things that doctors, have experienced. And I think it's a great opportunity to not let go of. And I think I've been very blessed. So I think that, no one should put this behind, and, just make sure that you take care of yourself. And if you know there's something wrong, do something about it. There's nothing to lose, really.
And there's a lot to gain. So I want to offer words of encouragement for every patient who is suffering from Cushing's. I know that, like you said, diagnosis can be the most daunting phase because it takes so long until you get the diagnosis, but it's also the first step for healing. And although it is difficult and the healing can have multiple obstacles along the way, and the path is not always short and can take time, we are here for you as medical professionals. We're here for you, to listen to you, to have conversation about the condition, and to come up with a plan, like what's the best plan that suits you. So we are definitely here for you, and we're gonna work together, and step by step, there is a way to healing.